Nutrition after liver transplant. Nutrition plays an important role in your recovery after liver transplant. You need enough calories and protein for wound healing. Your diet should be well balanced and contain foods from all food groups, such as meat, fish, poultry, fruit, vegetables, cereals, and grains. Right after transplant, you need extra nutrition to replace the weight you lost when you were sick. In the long term, you will need a healthy diet to maintain your weight, but to avoid gaining too much. Short-term nutrition. About 0 to 4 weeks after transplant. Eat lots of high-protein foods at each meal because high doses of prednisone cause protein breakdown and you need protein to maintain good healing. Good sources of protein include meat, poultry, fish, eggs, no more than 3 egg yolks per week, egg substitutes, and dairy products like milk, cheese, and yogurt. Good vegetarian sources of protein include nuts, peanut butter, dry peas and beans, soy products, and tofu. Just be careful to avoid elevated potassium levels. Right after surgery, be careful with concentrated sweets. The steroid medication can elevate blood glucose levels. Avoid excess salt after your liver transplant. Prednisone can cause you to retain sodium in water and increase your blood pressure. Avoiding salt and high sodium foods will help. Avoid adding salt when cooking. Don't have salt at the table and avoid, obviously, salty foods. Some foods to avoid include high salt soup, processed meats, canned meat, canned fish, salt pork, processed cheese, canned or frozen packaged dinner, processed vegetables, pickles, canned vegetables, frozen vegetables with sauces, starches, salt crackers, pretzels, potato chips, corn chips, salted popcorn, salted nuts or seeds, buttermilk, tomato juice, and vegetable juice, pickled relish, olives, garlic salt, onion salt, celery salt, and salad dressings. Limit these condiments: ketchup, mustard, horseradish, barbecue, chili, and other sauces. Long-term nutrition starts 4 to 6 weeks after transplant. You should continue to limit salt and sweets in your diet. This is to avoid side effects with your anti-rejection medications. You need to eat enough to maintain desirable body weight, but you are at risk to gain too much weight because of some of the medications. Follow these suggestions to avoid gaining too much weight. Limit high-calorie foods. Substitute free foods like sugar-free chewing gum, mints, gelatin, popsicles, soft drinks. Use low-calorie dressing with your salad. Include a daily alternative to snacking, such as taking a walk or working on a hobby. Monitor your weight closely. If you gain more than 2 pounds in a week, reduce your portion sizes at meals. Remember to watch out for sweets. High cholesterol, high triglycerides are another potential side effects of your medications. We recommend a heart-healthy diet to prevent heart disease. Read food labels carefully to avoid foods that are high in saturated fat and cholesterol. Avoid coconut oil and palm oil, which are saturated fats found in many baked foods, whipped toppings, coffee creamers, and fried foods. Choose homemade baked goods so you can control the ingredients. Use low-fat whipped toppings. Bake, broil, steam, or boil foods. Choose fish, chicken, turkey, and lean meats. Remove the skin from chicken and turkey before cooking. Use dry beans, peas, and lentils instead of meat. Limit egg yolks to 3 per week and red meats to 3 to 5 servings per week. One serving equals 2 to 3 ounces. Avoid high-fat foods such as bacon, sausage, hot dogs, cold cuts, and organ meats. Choose non-fat and low-fat 1% milk, yogurt, and cottage cheese. Choose cheese made from skim milk and limit the amount of cheese in your diet because of its high sodium content. Avoid cream, whole milk, cream cheese, and high-fat cheese. Eat more fresh fruits and vegetables. Avoid adding sauces, fats, or oils to vegetables. Choose whole grain breads, cereals, pasta, and brown rice. Low-fat breads include bagels, pita bread, corn and flour tortillas, pretzels, and breadsticks. Avoid high-fat snacks such as chips and pastry. Choose olive oil or walnut oil for flavor and canola oil for cooking. Choose low-fat or non-fat mayonnaise and salad dressings. Limit your total fat intake to no more than 4 servings per day. One serving would equal 1 teaspoon. Nuts are high in fat, so don't eat too much and pick healthy walnuts, pecans, or almonds. Eat foods high in calcium like non-fat or low-fat milk and cheese. You can also use calcium supplements. Your calcium intake should total 1,500 milligrams per day for good bone health and to decrease your risk of osteoporosis. Food safety. You may be at increased risk for food-borne infections because of your immunosuppressive therapy. To prevent foodborne illness, wash raw fruits and vegetables well under tap water. Defrost frozen foods in the microwave or refrigerator only. Never leave them out on the counter to defrost. Leftovers should be reheated to 165 degrees Fahrenheit. Also take the following precautions. Do not eat hot dogs and luncheon meats unless they are reheated until steaming hot. Do not eat soft cheese. Do not eat refrigerated meat spreads. Do not eat refrigerated smoked seafood such as salmon, trout, whitefish, cod, tuna, or mackerel. Do not drink raw, unpasteurized milk. A word about exercise. Exercise has so many benefits, including helping maintain a healthy weight, so try starting with a walk in the park or in your neighborhood. Ask a friend or a family member to go along. Gradually increase your walks to 4 per week and then daily. You will burn more calories and help your heart. You will also feel stronger and more relaxed. In conclusion, recovery is a very important time and you may not get another chance. Take good care of yourself and enjoy your life to the fullest.